Hey guys, thank you for checking out my video. As you can see by the title of this video, I'm going to be talking about what meds you leave with after having bariatric surgery. So I've already talked about like the stuff that I got from the grocery store or things that you need to eat week 1 and week 2 for your post-op diet, but I didn't talk about what medications you need to be taking or I need to be taking um, post surgery, post-op surgery. Um, so this is just going to be a really relaxed video. I know I have a full beat on. Well, not full on, but I have my makeup done, but I'm wearing my PJs and I'm about to head to bed. But I just thought about this video while I was taking my medications, and I thought you guys might want to know. Like, some people don't like taking medications, and this might deter you from getting this surgery because you're gonna be on medications and you're gonna have to take them. So we're gonna start it off with the probably the first thing that they give you at the hospital. Um, and that's probably gonna be Tylenol for your pain. Um, they're not gonna give you ibuprofen or aspirin, no NSAIDs. You're mainly gonna be on Tylenol, and that's what I have here. Tylenol. Um, they give you to take home as well. Um, it's to help with the pain, but it's mostly to the most pain that I felt was pain from gas in my stomach. That was really, really, really painful. But it just had to be released. So I probably only took the Tylenol at the hospital once or twice for my incisions when they were tender, but I haven't taken it since I'm lying. I took it one day since I got home from my surgery, and I haven't taken it since because I haven't needed it. The next medication that you're going to be taking, and they're probably going to give you this at the hospital as well, and to take home at home, is simethicone. This is Gas-X, if you've seen it over the counter at your pharmacy. And this is really one that's really easy. It's one tablet and you just chew it or you can suck on it. It's like a minty flavor, and obviously this is supposed to help with the gases that are trapped in your stomach or in your gut, and you'll be taking that in the hospital as well as when you are home, only as needed. So I first wanted to talk about the medications that you would be given at the hospital, like starting off at the hospital, but also be taking at home. And so the last one that, not the last one, I'm lying. I'm gonna head into this one. The next one that you'll be getting at the hospital is an anti-reflux, acid reflux medication. So when I was at the hospital, they gave me pantoprazole, but they sent me home with omeprazole, and it's just these little capsules. They're easy to swallow, and you're taking this to prevent any ulcers in your stomach. And it's just once a day. I'm not really sure why they switched it up at the hospital. They were giving me pantoprazole, like I said, but they sent me home with that. And they expect you to take this, I guess, for a while. I thought it was only for 2 weeks. That's what the nurse told me, but it shows here that I have 5 refills. And you probably don't need to take it for that long if you don't have if you normally don't have acid reflux. I'm not a doctor, but this is what the nurse told me. If you normally don't have acid reflux, this is just a preventative so you don't get any ulcers in your stomach. Hold on, my cat is making so much noise right now. Okay, he stopped making his noise now, his shenanigans. So yeah, from what the nurse told me is that I would be taking it for 2 weeks because I don't have acid reflux. Normally, I've never taken any medication for acid reflux. So I would be taking it for 2 weeks. So I guess when I follow up with my doctor on Monday, I will double check and make sure that I can stop this medication after 2 weeks, because it doesn't say it in the bottle. It just says to take 1 capsule daily. But they will send you home with some acid reflux medication. And then the next medication that they're going to send you home with, and that you'll also be getting at the hospital post-op, is Lovenox, which is an injection. I already opened this one up because I used it. So you'll be getting an injection it's a blood thinner, and they're most likely gonna have you do it yourself at the hospital. If you don't like needles, they'll have you do it to yourself so you can learn and practice how to do it and kind of get rid of that fear. But I know they make medications that are blood thinners that you take orally, but I don't think that is an option for you, even if you're afraid of needles, because when I was talking to my doctor, they asked me if I was afraid of needles, and I told them that I am a little bit afraid of them, that I don't like needles. And they're like, is that going to be a problem? And I'm going to be like, and I told them no, because obviously this is something that I have to do. So I'm going to have to get over it. So I don't think that they can switch you from taking the injectable blood thinner to the oral blood thinners. But honestly, is a really fine needle. It's a really fine needle. It's a little prick. It doesn't hurt, and it's quick. 1, 2, 3. So they'll be giving you this injection at the hospital twice a day, every 12 hours, and then you're expected to do that at home as well, every 12 hours for 14 days. That's what I was told for me personally, that I would be doing it for 14 days. It might be different for you, but for 14, they sent me enough medication home with for 14 days. And so these 4 are the medications. These 4 medications that I talked about are the medications that I was given to at the hospital and to be taken home with as well. And they also gave me electrolytes at the hospital, but they didn't tell me to take home any, they didn't tell me to take any electrolytes at home or anything like that. So, yeah. Also keep in mind that while you have the surgery and you're starting to introduce foods, if you're feeling nauseous, they might give you anti-nausea medication at the hospital, but they didn't send me home with any. I've been experiencing nausea at home and the sensation to vomit, but I was not sent home with anti-nausea medication, so I've just kind of been dealing with it and letting it pass naturally. So yeah. Now here's the fun part. If you thought this was over, it's only just begun. So the next medication I want to talk about is one that's not so fun. And that's, I'm gonna close the label here so you can't see it, but it's Miralax. They're gonna send you home with Miralax because when they put you under anesthesia, for some reason you can't go number 2. Maybe there's some rare cases of people that are able to, but most people can't go number 2 after being put under. So they send you home with this for constipation so you can use the bathroom. It took me a week to get a bowel movement. I only took this once and thinking that it would help me have a bowel movement right after I took it. But I guess you have to drink this once daily consistently to be able to get a bowel movement. So maybe that's why it took me longer to get a bowel movement, because I only took it once. And it's not because it tasted bad or anything like that. I just was on so many other medications that I didn't want to bother with this one. It's a powder. I'll open it up. I'm sure you've seen it before. It's a white powder. It doesn't taste like anything, so you can mix it in with water or juice. It dissolves kind of a little bit, but you still have some grittiness, but it's not bad. I just didn't take it because I just didn't feel like I needed it. I honestly felt like I was gonna have a bowel movement soon, but I was obviously wrong because I did not have a bowel movement for a week. Now the next medications I'm going to show you are medications that I was sent home with, and I was told to start at a later date, so not right after I got home. I was told to start it 2 weeks after post-op. So that's why I'm showing you those medications now, later. I hope this makes sense, this video. Oh, I forgot to mention something. You're also supposed to be taking a multivitamin. They're going to be giving you a multivitamin at the hospital, and they're going to send you home with the multivitamin at home. But you should already be taking that pre-op. Pre-op, they already tell you what multivitamins you can take. You can't take gummies. I've been taking a dissolvable tablet or a chewable tablet, but they still sent a prescription for a multivitamin at my pharmacy, and once I finish those tablets, then I'm going to start taking the prescribed multivitamin, which is just a regular multivitamin. It's nothing special, nothing fancy, but I didn't mention it before because that's something that you should already be doing it pre-op. So I'm not sure why these medications I'm not supposed to start right away. I wasn't supposed to start right away after my surgery, and I had to wait 2 weeks post-op to start taking them, which it hasn't been 2 weeks for me. It's only been a week, so I haven't started taking them. Actually, I did take them the first day I got back, and then the second day I realized that I was not supposed to be taking them, and that's why I stopped them. But that's why it's good to read your discharge paperwork, because it was all there. I just wasn't paying attention to it. So the first vitamin is calcium citrate with vitamin D3, and they want me to take 2 tablets twice a day, morning and evening. And calcium tablets. I hate taking calcium because the tablets are big. They don't look that big on the camera, but let's see if I can focus a little bit more. I hate swallowing these oblong tablets. They just don't go down my throat smoothly. So I'm happy that I haven't had to start these yet, but I'm gonna have to start them soon, and I'm gonna have to be taking 4 a day, so I'm gonna have to get used to it. But yeah, that's something that they are gonna send you home with. Along with that multivitamin, they also want you to take vitamin D3 50 micrograms separately from the vitamin D3 in the calcium. I think this is Citracal, brand name Citracal, but this is the generic version of it. And these are just small little tablets, easy to swallow. And that's one tablet once a day. The next medication they're going to send you home with, this is just a multivitamin that they sent me home with that you should already be taking. The next medication that they're going to send you home with is vitamin B12 500 microgram tablet. The dosages might be different for you. I know that at the hospital, before they discharged me, they did blood work, so these vitamins that I'm getting might be based on the blood work that they did. So depending on your blood work that they do on you, you might be taking less, you might be taking more. So keep that in mind. This is based on my blood work. And this is just vitamin B2 500 microgram tablet. They're a little bit slightly larger than the vitamin D3. These are pink. I wonder if these are chewable. I don't think so. I wish they were. And then the last thing that they sent me home with was polyiron 150 milligram capsules. And this is what they look like. Kind of like the anti or acid reflux medication, the omeprazole. And yeah, they might send you home with that as well. I don't know what the difference is between regular iron and polyiron. I looked it up, but I forgot. So yeah, guys, those are all the medications. How many is that in total? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 medications that you're going to be taking post-op. So keep that in mind. If you're a person that does not, let me make sure I didn't miss one. No. Keep that in mind. If you're a person that doesn't like taking medications, that you're going to probably be on these for life. I've heard of very rare cases where people get bariatric surgery and they don't have to take vitamins. They don't have to supplement vitamins. They are still getting enough vitamins from their foods. But that's not the case for everyone. So don't think that's going to be the case for you. Just automatically assume that you're going to be on vitamins for the rest of your life because your body is not getting as many nutrients as it was getting before, prior to you changing your anatomy. So I hope this video was helpful. I hope that it helped you make your mind up regarding your surgery. It helped you either move forward with the process, you're okay with taking these vitamins and minerals and whatnot, or you're a little bit hesitant because you don't really like taking tablets or capsules. So just think about it. Everyone is different and your journey is going to be different. Talk to your doctor. That's really important. Make sure you do your blood work. And if you're concerned about something, just bring it up to your doctor. That's really important. Just talk to your doctor about it. Don't just go home with the medications and decide not to take them. Because your doctor's going to know whether you're taking them or not, because they're most likely going to be doing routine blood work on you even after you get discharged from the hospital to make sure that everything is looking okay. But thank you guys for tuning in for this video. I really appreciate you guys watching my videos and watching my content, and I hope it's helpful. Yeah, keep on the lookout for more. I have a doctor's appointment on Monday, and I will let you know what they say, if I can move into pureed foods, which would be awesome because I'm tired of this liquid diet. I've been getting so much nausea, and I've been feeling really hungry throughout this whole process. So hungry, like no amount of Jello, no amounts of ice cream, sugar-free ice cream, no amounts of juice or water or protein shakes is helping me stave off this hunger, to be honest. And then I know that it's more mental than it is physical hunger, because I'm still putting something in my body, but my mind is craving food. So it thinks it's hungry because it's not getting the food that it's craving. So that's been hard and difficult. But yeah, that's all I have to say. Thank you guys so much for watching my stuff. I really appreciate it. I'll see you next time. Bye.